Welcome back to Sleep Better TV. I'm Scott Drake. My guest today is Dr. Stephen Lawson with the TMJ and Dental Sleep Therapy Center in Winnipeg. We're talking about recent studies that seem to show a link between cancer and obstructive sleep apnea. Dr. Lawson, welcome. Can you talk a little bit about what this study seems to show, as well as all the other studies that show a link of negative health effects to OSA?
Yeah, before getting to the cancer one, again, I mean, it's like on a daily basis, it seems like we're learning more and more about, the effects of OSA, depression, and high blood pressure, just a barrage of issues. One of the more current ones, however, is the issue of cancer. And what's being reported now is that sleep-disordered breathing, commonly known as sleep apnea, is associated with an increased risk of cancer mortality. Previous studies have associated sleep-disordered breathing, with hypertension and cardiovascular disease and depression, but this is the first one that was actually linked to cancer. The study shows that nearly there's a 5 times higher incidence of cancer death in patients with severe sleep-disordered breathing to those without this disorder. Clearly there's a correlation, and we're not really proving at all at this point, that sleep apnea causes cancer or contributes to its growth, but animal studies are showing that this intermittent hypoxia, or inadequate supply of oxygen, that characterizes sleep apnea does promote increased vascular growth and tumor growth. So I think we need to be aware of just, another area that that deals with the problems that we're going to have with sleep-disordered breathing.
So just to clarify too, these studies may show that OSA doesn't necessarily cause the disease, but in the event that someone has the disease, OSA could make it a lot worse.
Well, that's exactly right. You're not into the cause. You just have to realize that this continuum of hypopneas and hypoxias and intermittent breathing problems, they will eventually affect an awful lot of the systems in the body. And now they're just looking at this particular correlation that has to do with the decrease in the oxygen supply and how it promotes increased vascular growth and tumor growth in the study. So that, of course, that's what cancer is all about, isn't it?
Yeah, and so for the consumer out there, the cancer is starved of oxygen. It naturally just creates more pathways to get more oxygen, thus it grows, right?
That's exactly right.
Okay. It's very interesting studies and continues to show the link of OSA to all kinds of health problems. Dr. Lawson, always a pleasure. Thanks for joining us.
Well, thank you. It's my pleasure.
Once again, he is Dr. Stephen Lawson. You may find him happily at the TMJ and Dental Sleep Therapy Center in Winnipeg. This is Sleep Better TV. Thanks for watching.